This video is for B.Ed second year students, and we are doing paper titled Creating an Inclusive School. In this series, this is part 3 of this particular series where I teach you this paper. And in this particular video, we are going to study learning disability along with multiple disabilities. These two topics in detail, in depth. Let's get started with learning disability. Now, this is a general term that describes specific kinds of learning problems that cause a person to have difficulty acquiring certain skills. Now, the skills most often affected are reading, writing, listening, speaking, reasoning, analysis, etc. This term does not include learning problems that are primarily the result of visual, hearing, or motor disabilities, or for that matter, even mental retardation or emotional disturbance. The term is used to describe the seeming unexplained and unexpected difficulty a person has in acquiring basic academic skills. Now, some characteristics of learning disabled children are that students exhibit deficits in social skills. They experience no problems getting along with their peers or teachers, but they display behavioral problems in the classroom. They have a processing disorder which affects the ability to understand or use language, and even difficulty in listening, thinking, speaking, reading, writing, in spellings and mathematics. Students may usually also have average or above average intelligence. There seems to be gap between the student's ability and actual achievement. Difficulty with reading is by far the most common characteristics of students with learning disabilities. Now, there are major types of learning disabilities. There is number 1, dyscalculia. In this, as the term slightly suggests, a person is unable to or faces difficulty mostly in understanding numbers and learning mathematical facts. The second is dysgraphia, in which person's handwriting ability is disturbed, and there are no very fine motor skills are absent. Then there is dyslexia, which affects reading and related language based processing skills. It is sometimes referred to as language based learning disabilities, and some very captivating movies have also been made on dyslexia. The next one is dysnomia, which is a word finding problem. The child keeps stumbling over words that he cannot remember at the moment. There is dysarthria, which includes a slurred speech and sounding hoarse. There is apraxia, in which a person seems to be trying very hard to speak and talk slowly and have greatest difficulty with starting. And the last one is ADHD, that is attention deficit hyperactivity disorder, in which there's difficulty in staying focused and paying attention continuously, difficulty in controlling behavior, and there is hyperactivity. Now, some functional limitations of learning disabled children include academic problems, disorders of attention, poor motor abilities, psychological process deficits, lack of cognitive strategies, oral language difficulties, reading difficulties, written language problems, mathematical problems, and social skill deficits. Some causes include heredity, problems during pregnancy and birth, and incidents after birth like head injuries or malnutrition. Some educational provisions for such children are free appropriate public education, identification and evaluation, individualized education programs like the IFSPs, that is individualized family service plans. There is also least restrictive environment to let the children be educated to the maximum extent possible. There is also due process safeguards and parent-student participation and shared decision making. The next topic which we are going to study is multiple disabilities. Meaning of multiple disabilities is that it is a combination of two or more disabilities as defined in the clause of section 2 of the Person with Disabilities Act 1995, namely blindness, low vision, speech and hearing impairment, locomotor disability including leprosy cured, mental retardation and mental illness. Some characteristics include vision problems, hearing problems, learning problems, communication, posture and mobility problems, odd behavior, medical conditions, and prevalence, that is having severe multiple disability, is the percentage having is very low. And the types of multiple disabilities are three. There is number one, that is coinciding disabilities, which are inevitably causally linked. The second is which are not linked by a causal factor, and the third is coinciding disabilities, which are not inevitably related. Impact of the following on a learner is that most of the students served under this category do have some level of cognitive impairment, but the diagnosis of this can be ambiguous or undetermined. And developing age appropriate adaptive skills is very challenging for these students. Deficits in motor development can impact independence as well, and sensory impairments may also be present in these students. Perhaps most importantly, students with this disability have deficits in the area of communication, making it difficult for them to even communicate their wants and needs and pain around them. So, some teaching strategies for multiple disabilities include early intervention, which is very necessary. So, if there is early intervention, then to a maximum extent a student can be helped. And then involvement of the appropriate professional, that is occupational therapist, speech language therapist, physiotherapist, etc. And then thirdly, we need to have a team approach at the school level involving external agency who meet on a regular basis, which is essential. Fourthly, the physical arrangement of the classroom will need to best accommodate the child, considering special equipments and assistive technology. Then integration among their peers is also very important, because it is important to integrate them as much as possible. Research indicates that when these students attend community schools and participate with their peers, their social skills develop and are enhanced, which is very important. Ensuring that all students demonstrate respect for multiple disability students becomes a teacher responsibility and needs to be taken very seriously, with the ongoing activities that develop respect from the other students in the class. An individual education plan will need to be carefully planned out and adjusted on a regular basis, and will need to be aligned to the child or the learner. Remember that these children are often completely dependent on others and most or all of their needs sometimes. Assistive technologies may assist this child, and the support team will need to decide which assistive technologies will be most appropriate. And again, very importantly, a safety plan will also need to be developed, and care needs to be given in your expectations of this student to ensure the child does not become frustrated. And most importantly, these identified children are to be given the same rights as non-identified school age children, including screening, evaluation, and an appropriate program and services. With this, we complete multiple disabilities, and we began with learning disabilities. In the next video lecture, we will study about building a inclusive education system. We will study the characteristics. First, we'll discuss the meaning and definition, of course. Then we will discuss the process, assumptions, and we will also discuss and see the differences between traditional approach and inclusive approach. If you have any doubts, you can contact us through the given contact details.